Thank you very much for joining me today. My name's David Wortley, and what I hope will be a useful session is passing on some tips that have helped me to manage my own personal health. And I'm delighted to be able to welcome into the studio a friend of mine, Professor Ron O'Donnell. So I'm going to ask Ron to introduce himself. He's speaking from Arizona State University. Ron, would you like to say a few words about your background?
Thank you, David. I'm Ron O'Donnell, a clinical psychologist and clinical professor at Arizona State University in the College of Health Solutions. I'm the founding director of a doctoral degree program called Doctor of Behavioral Health, and our focus is creating a new workforce of clinicians and managers emphasizing integrated healthcare, meaning bringing together in a single place primary care, family practice, experts in behavior change who can address both chronic disease, hypertension, diabetes, education, medication management, lifestyle change, nutrition, physical activity, stress management, and of course, addressing the very common comorbid psychiatric and substance use disorders that our patients experience. I also emphasize global health. I'm doing research and consulting on this topic in China, Southeast Asia, and South Asia. Thank you, David.
Thank you very much for that, Ron. I'm sure we'll have plenty to talk about. We've got a really packed program, so there's a lot to get through today. So I'm going to start straight away by loading up a presentation onto the screen. And I'm going to use this presentation as a kind of basic. It really is a warts and all journey through my experiences of managing my own personal health over the last 9 years. And it's just a little disclaimer about the beginning, because I don't want you to think that what I'm about to tell you is prescriptive, and it's based on detailed clinical research that I've undertaken. A lot of the ideas are taken from lifestyle medicine. And if you want to know about professional practices all around the globe, the best place to go to is the British Society of Lifestyle Medicine website, which I've shown on the screen there. So that is my disclaimer, but I hope that my experiences will be useful when you're looking at managing your own personal health. So the context behind all of this is that we're really facing some serious challenges as a result of the aging society. The picture that I show on the screen there is my mother when she was in a local hospital after being taken in as an emergency, and the principal problem with her was a total lack of hydration, and in fact she came very close to dying. But the problem is that as we age, we need more medical care, and there are fewer and fewer working people to cover the costs of that care. And unlike when I was growing up, a lot of the care was responsibility of the family. It's now shifted as a result of demographic changes to responsibility of care homes. And so elderly care is, in the UK, certainly a poor relation of public health services. And what's made it really brought to the circus, made a focus on it, is coronavirus. And I know Ron's going to share a few things about that. So the aging society challenges that we see, needing more healthcare as we get older. And so there are fewer and fewer working people able to support those costs. So what do we do about it? Well, we need, as a society, and this is an observation made by the boss of the NHS Health Services, Sir Simon Stevens, a few years ago, actually, making the point that, in particular with obesity, this is something which is essentially like a cliff face that we're in danger of dropping off. So we need to transition from cure to prevention, and we need to make some behavioural changes in our lifestyles. And that is really how I started, not particularly because I had any health problems, but more to do with the fact that I wanted to see if I could make some positive difference to my health and my lifestyle. So these are some of the key health and well-being influences that we're going to cover today, and I'm going to talk about my experiences and give some hints and tips that I hope will be useful to anyone watching this, either this live presentation or recording. So we're covering exercise, diet, relationships, sleep, alcohol and harmful substances, stress management, hydration, and digital health and wearable technologies. So the steps involving effectively behavioural change, and these are the steps essentially that I took, where you need to be able to measure those key influences that affect your health. There is a saying that if you can't measure something, you can't change it something. And because we're all individual, once you're able to measure these key influences, we need to have our own personal benchmarks, which are based on our individual circumstances. And those circumstances will help us to set goals, which are partly challenging, but also are realistic and achievable. We need to build a supporting environment, and I believe that we should provide supporting digital therapies, and I'm going to talk about that towards the end of my presentation. And finally, it's all about encouraging personal responsibility and control and management over our own health. So in my case, I can show you what it did for me over a period of time. I started off it's some 16 years ago, 14, 16 years ago. This is what I looked like then in 1998. And I was still obese in 2008. But in 2013, for a variety of reasons, nothing to do really with my health, but more to do with people telling me that I was fat and that they were worried about me. But a combination of circumstances in May 2013 led me to see if I could improve my physical and mental health. And within 3 to 4 months, I'd actually lost 21 kilos. And I'm going to explain to you how I achieved that and the lessons that I learned from that.